Okay, I will be demonstrating how to start an IV. Okay, so first we want to start off by cleaning off our table on which we will be putting our supplies. Okay, so now we've got a clean surface for that. While that's drying, we want to assess the patient's fluid status, and we do that by looking at their blood pressure, their INO, their level of consciousness, their skin turgor, their weight. We also want to assess any allergies they may have to adhesives, iodine, or latex. Most facilities do not use latex anymore, but occasionally they will be in our tourniquets. We want to look at any bleeding tendencies that they might have. For example, if they're on warfarin, their blood will be thinner. So when we're putting in our IV, and especially when we're taking out our IV, we're going to have to hold pressure for a longer amount of time. And again, with the fluid status, their level of hydration will determine how full their veins are. So if they're more hydrated, their veins will be a little fuller and easier to palpate, easier to start an IV, whereas more dehydrated, it'll be a little bit more difficult. And again, if they're having edema, that'll be another sign of possibly some fluid overload. We want to look at our orders. So we want to see what type of fluid is running, the rate, how long will that be running. That'll help determine where we will be putting our IV. So we want to avoid sites like the hand, the wrist, any bony prominences. The hand and the wrist, the skin tends to be thinner and the veins are not quite as, they're a little bit more fragile. So we want to avoid those, and they wouldn't be able to hold an IV for very long. Okay, so that is, and also, with the rate and the length of infusion, that'll help determine what size needle we want to use as well. Okay, so now that that's been cleaned off, I want to wash our hands again. Okay. Want to get some gloves on. The other thing that we want to assess is how the patient's history of disease and scarring. Let's say they are somebody who is on chemo. Let's say that maybe they had a left-sided mastectomy. Left-sided mastectomy, we would start the IV on the right side and vice versa if it was a right-sided mastectomy. And with scarring, we would want to avoid that area as well. And oftentimes, patients will be able to tell you which side IVs tend to start better on and what site. So the patient is always a good source of information for that. Okay, so we've got our tourniquet and our ChlorPrep here. We've got our stat lock for when the IV is in place. Got some alcohol wipes for when our IV is started and we want to hook it up to our fluid or our medication, whatever we have in our orders. Our flush, PosiFlow, J-loop. I've got a 24 gauge needle here, and also I have some tape. So I'm going to start with my 2 pieces of tape, and these 2 pieces of tape will be used for one of 2 things. either to secure down my J-loop, or if I'm unsuccessful with starting my IV, that's gonna go over the gauze to keep the gauze down. Okay, and now we wanna get our J-loop all started here. So we open up our J-loop. We take, and then we've got our posi-flow. Okay, so we connect those. Next, what we want to do is take our flush and make sure to get all of the air out of our flush. Okay, looks like we're good. Next, we want to prime our J-loop. Making sure that it's okay. Now that's been primed. Okay. All right. Okay. All right. So I've got all my supplies ready. All right. So now I want to identify the patient, making sure that I'm being with who I should be with. All right, so can I get your name and your birthday? All right, I've checked their wristband, I've scanned their ID, it matches my records, what I needed to see. So, all right, so I'm gonna take my tourniquet. Now there are a couple ways that you can dilate a vein. Okay, we can use our tourniquet. We could pack the patient, which means taking warm, moist towels, wrapping the arms. That'll help dilate. And the other thing that we could also have the patient do, pump their fist, or sometimes people will squeeze a ball, and that'll help dilate the vein as well. So we're going to be using our tourniquet. Okay. We want to be able to get a finger in there, but not much more, because we want it to be tighter. Okay. All right. So this feels like a nice, juicy, palpable vein that we've got here. Okay. So I'm going to undo that, and I also want to get my Tegaderm ready here as well. Okay. Now I got my stat lock there too. Okay. So I'm going to break my ChlorPrep here, and I've decided on which vein to use. So for 30 seconds, using friction, going in a circular motion, I'm going to use this ChlorPrep. And at this time, you can discuss any concerns, any fears that the patient may have. Confirm with them that, yes, this is not a completely pain-free procedure, but the pain should be rather brief. Help calm any fears that you or the patient may have. Okay, so that's been 30 seconds. And then it also needs to dry for 30 seconds. And while that is drying, I am going to wash my hands once again. Put on a pair of new gloves, because I am dealing with blood and we will be creating a portal of entry. our needle. All right, and before I take my needle out, I'm going to about 4 to 6 inches from the site that I've decided on. Okay, let's get that again. Okay, I'm going to be doing bevel up and going at about a 15 to 30 degree angle. We will insert. And you want to make sure not to touch the area, again, that you just cleaned with the floor prep, because then that would create an unclean site. Okay, then you want to look for a flash of blood. All right, and once I see that, I'm going to be lowering my angle. I'm going to be pushing or putting my catheter forward, pulling the needle out, applying pressure. All right, I am getting a blood return here right away. So as quickly as I can, and you want to make sure that you have a chucks like I do underneath. If blood is spilling. Okay. All right, so I've now attached. Okay, I want to aspirate. Oh, and making sure that you undo your tourniquet. I'm going to aspirate for a blood return, which I'm getting. Okay, and then you want to go ahead and flush at least 2 milliliters, or per your facility policy. And you want to make sure to if the blood comes back into your flush, you want to keep flushing until all that blood has gone back into your patient. Okay, and if that means doing the whole thing, then that means doing the whole thing. That's okay. Okay, so now I'm going to clamp. I'm going to disconnect. Okay, I'm going to take my skin prep. And this is only for demonstration purposes, because we wouldn't, if we got this stat lock on, we wouldn't be able to get it off. So we've got that. You want to take your stat lock, and you should be able to hear a click. Arrows facing the patient. You would take the papers off of the adhesive side just like you were putting on a bandage. Okay. And then this is when we use our tape. We want to tape down our J-loop. This tape is not staying so well. Okay. All right. And then now we would take, and again, this is a per facility policy procedure. So with your tegaderm, some facilities want you to put it directly above the insertion site. Some want you to put it over the whole thing. So you just need to check with your facility. Okay, so I'm putting that over, securing that. Okay, so that is on there. And then now at this time, if we were connecting, we're running fluids, medication, whatever's been ordered. So I'm taking my alcohol prep, cleaning my port for 15 seconds, asking the patient, how you doing? How does that feel? Is that comfortable? Okay, using friction. Okay, that's been 15 seconds. I also want to take my line, and I can see that everything is, I've double checked all my orders, name confirmation. Okay, 15 seconds. Okay. attach that. So that's been attached. And then also, after you attach, you want to make sure to unclamp your J-loop. You want to make sure your roller clamp is open, your IV is dripping, everything is going. You want to wait until you see that you're having return. So after you have done all of that, I want to remove my gloves, wash my hands, and I want to document the site, the time of insertion, what was inserted, at what rate, the dressing, and the patient reaction. And scene.